Most people have a fairly regular bowel regime, and it is not their favorite topic to discuss. Normal bowel movements are soft and regular, often once every 1 to 3 days. The word constipation means difficulty emptying the bowels and is often the result of hard feces. For people at the end of life, there are several factors increasing the difficulty of emptying the bowels and making them prone to hard feces. At the same time, as the body shuts down, it is completely normal to have fewer stools and changes in the bowel regimen. It is important to assess the difference between normal changes at the end of life and constipation, which can be quite painful. Let's begin by looking at some of the risk factors associated with constipation. Many medications, including morphine and other opioids, have a side effect of constipation. Patients are often more sedentary, of even bedbound, which slows the bowels and is a risk factor for constipation. The body is naturally less thirsty and is more comfortable in a drier state at end of life, which can result in harder stools and constipation. It is important that we continue to give the medication a patient needs to let them rest and not force them to drink when the body is shutting down. So how do caregivers prevent, assess, and treat constipation? Today we will provide helpful methods to keep your loved one comfortable. First, assess carefully. Watch for nonverbal signs of discomfort or pain, including furrowing of the brow. Specifically, an increase in the lines between the eyebrows can be an indicator that a person is hurting. The hospice nurse will listen for bowel sounds to determine if the bowels are functioning. Second, if your loved one is able to speak and rate their pain, it is important to use a scale and to speak openly about constipation. Record their levels of pain over time so that you can assess any patterns and monitor for changes. Third, log quantities of eating. When a person eats less, we anticipate that their bowels will move less and there will be less stool. It is helpful to keep a log of how much the patient is eating and the frequency and consistency of bowel movements. For a patient at end of life, consistency of bowel movements, are they soft or hard, is as important as whether they are having a regular bowel movement. As a part of the plan of care, the hospice team will create a bowel regimen based on the patient intake, history of constipation, and current stool consistency and frequency. This plan of care is only successful with input and adjustments based on needs. The care plan will include a diet that may be adjusted based on the patient and family goals. Lastly, ensure the patient is comfortable. The hospice medical director may recommend an oral medication, a suppository, or an enema to treat constipation. A warm compress to the abdomen can help alleviate discomfort associated with constipation. Caregivers play a vital role in maintaining patient comfort. By working together, we can improve the patient's quality of the care and the patient's end-of-life experience. Always reach out to your hospice nurse if you have any questions or concerns.